Record. Got it. Yay.
All right, I'm going to let everyone in now. Good luck, everyone.
Okay.
Thanks. We're gonna need it.
Good morning.
All right. Hello there, everyone. Good morning. We are so excited to welcome you to this month's Canna Talk. As many of you know, my name is Genesis Emery, and I'm the Director of Marketing and PR for the Society of Cannabis Clinicians. On behalf of the SCC, we couldn't be more excited to see you guys today and bring you the latest educational insight on this month's featured course, which is Cannabis for Health Promotion and Disease Prevention, brought to you by the trailblazing course expert and world-renowned medical cannabis expert, Dr. Dustin Sulak. We are so excited to share Dr. Dustin Sulak's clinical research and his phenomenal insight on cannabis for health promotion and disease prevention. Before we get started, let's quickly go over a few brief housekeeping rules. Please kindly make sure that you guys mute yourselves at all times. In the event that you do need to step away or take a break, please make sure that you turn off your video so we don't see anything that you don't want us to see. Also, there'll be plenty of time at the end of the event to ask any questions that you have and do our Q&A session. So be sure to submit any questions that you have in our chat box. By the way, in case you guys did not know, you can purchase Dr. Sulak's featured course of the month directly from the SCC's course catalog page on our website. I will share the link in the chat box, and it will give you 20% off to the SCC members on the course, along with 15% off to non-members. The discount code you can use is Dr. Sulak 15 to purchase the clinical training course today. Other than that, please sit back and relax and enjoy our exciting segment of Canna Talk featuring Dr. Frye and Wilson King and the phenomenal Dustin Sulak. Without further ado, I'm pleased to introduce you guys to our SCC's Vice President and the co-host of Canna Talk, Dr. Janester Wilson King.
All right. Thank you, Genesis. Thank you so much. Good morning, good afternoon, and good evening, depending on your location. We are so fortunate to have people join us from all across the globe. Dr. Sulak needs no introduction. He is a good friend and colleague. He is an internationally renowned expert in medical cannabis and the founder of Integrate 8 Health and Healer. I'm sure most of you have attended his monthly educational webinars. He is on the board of directors of the Society of Cannabis Clinicians and is also the author of the recently published and soon to be bestseller, The Handbook of Cannabis for Clinicians, Principles and Practice. Dr. Dustin Sulak is here to talk about his module, Cannabis for Health Promotion and Disease Prevention. Welcome, Dustin. We are honored to have you at Canna Talk.
Thank you, Janester. I'm very happy to have an hour to spend with all of you, and I see so many familiar faces on the Zoom. Thanks for joining, everyone.
Yes, thank you. Well, I'm going to start with the first question, and it's probably the most obvious question. Why is it important to consider cannabis for health promotion and disease prevention?
So I think a lot of us are recognizing that our medical system globally, but probably especially in this country, has some opportunities for improvement, we could say. We spend more per capita than any other country on healthcare, and we have worse outcomes than any other of our kind of colleague nations, similarly developed nations. And in terms of our healthcare outcomes, pretty much across the board, we either rank last or near last. So we're doing something wrong. And I think there's a lot of things that a lot of tangents we could get off on here. But what I really want to focus on to answer your question, Janester, is that there's a disproportionate amount of spending in managing chronic disease after it already occurs, and then in dealing with the sequelae of those chronic diseases as they compound.
Uh-oh, he froze.
To have everyone frozen. Am I? Oh no. Everybody, it got frozen and then
now it's back. It's back now, yes.
Oh, I apologize for that, everyone. It said I just got a message that my connection is unstable, and I'm just going to try switching over to Ethernet and see if that helps.
Okay. No
Okay,
worries.
okay. Hopefully this will work. Did you get my answer, or shall I say it again?
I think we got most of it. You talked about how our management of chronic diseases is so incredibly costly that it might be a good idea to.
And
We need different modalities of treatment for these things.
Yeah, I think we just,
And
you know,
prevention.
the incentive structure in our healthcare system rewards managing and not curing chronic disease. And there's very little incentive to prevent chronic disease, which would probably be a much more cost-effective approach to healthcare, not to mention that it's going to help people stay happy and healthy if you can prevent their disease instead of just waiting until they're sick and plugging them in to the system. So I think in general, whether we're talking about cannabis or allopathic medicine or any integrative approach, it doesn't matter. The emphasis, I think, would benefit from some shift towards prevention and health promotion, and not necessarily in just the lip service ways that we tend to give it in conventional medicine right now, which is, I think that there's some recognition of lifestyle interventions, some of the things that we'll be talking about today as being a good idea. And we tend to, maybe mention that on the way out when we're seeing our patients and in the more conventional, less integrative setting. But there's not that kind of buy-in and investment. And so often the healthcare providers themselves are not examples of this. And it's, I think, hard for patients to take advice about lifestyle change and disease prevention and healthy living from someone who's not walking their talk. And so I think, but besides lifestyle change, then there's, what do we have? Statins and vaccines. I think we could do a lot more than that. These are, I don't mean to minimize it, but there's so much potential. And so when we look at cannabis, this incredible tool that we know interacts with the endocannabinoid system, which is certainly our primary kind of regulatory system for helping us respond to illness and injury, but it's also this homeostatic system to help us stay healthy in the face of stressors, and minor illnesses that could eventually become more chronic if we don't respond to them correctly. So if cannabis is so amazing at treating some of medicine's most challenging cases, I think it's important to just ask the question, well, what could it do to prevent disease if it can so effectively treat disease?
Amen. Thank you, Dustin. Dr. Patricia?
Yeah, no, I was going to say, so in your module, you talk about a number of very common chronic illnesses where the U.S. sort of leads the world in terms of obesity, diabetes, cardiovascular disease, stroke. How does cannabis or the use of cannabis, how might it help prevent some of these very common chronic conditions?
Right. So, and I think a lot of these common chronic conditions have some underlying pathophysiology that's in common, including chronic inflammation, which I don't like to simplify everything down to that, but that's so often a component of some of these conditions and a driving factor. And there's many influences from our environment that are promoting this kind of hyperinflamed, immune dysregulated state. Biological toxins and infections and the products in our food that are novel, in our medicines and in our air quality and so forth. We are being bombarded with physiologic stressors that often kind of promote this inflammatory response. So what I did in the module was I just said, well, let's take a look at the most common chronic diseases, or let's take a look at the most common causes of death that we're clearly doing a bad job of preventing in this country, and how might cannabis interact with some of these in a way that could potentially prevent disease. And what's the evidence for that? So in terms of the evidence, we have some human evidence, like epidemiologic data, some cross-sectional, other that's longitudinal, some looking at outcomes related to cardiovascular disease, outcomes related to diabetes and metabolic syndrome, obesity, outcomes related to traumatic brain injury, stroke, and other forms of neurologic injury. And in all of these, as you would expect, there's some signal that cannabis can, or the compounds in cannabis can have somewhat of a protective role. And so the data is very early. It's something I've been interested in for a long time, though, and it's exciting to see that the evidence is gathering both from the preclinical literature that kind of suggests this from an experimental perspective and even can elucidate the mechanism of action. And then we have this kind of human data that's also starting to show a signal that cannabis users may have better outcomes than non-users in certain settings.
Yeah, fascinating. Absolutely fascinating. I want to point out something else that you said in your module about, you talked about the psychoactivity of cannabis being often referred to, as we're all aware, as an adverse effect in most studies, and it is for some patients. However, the psychoactivity is an important factor in using cannabis for health promotion and disease prevention. And you called cannabis a living medicine. Can you explain that a little bit? And is that related to the psychoactivity portion?
Well, yeah, the great question. I mean, cannabis shows up in so many different ways for us and for our patients in our lives. So cannabis may be something that simply provides relief to some people, and that's very important. Symptom relief, kind of help them replace other medications that may have negative side effects. So that's one role of cannabis. Cannabis can also be used as a tonic for people that are healthy, but find that with certain use patterns of cannabis, they can enhance their performance, they can improve their resilience to stress, recover more quickly from injuries and minor illnesses. So that's another use pattern of cannabis. And then cannabis can also be a teacher or a mechanism of a repatterning of our physiology and our patterns of thought and behavior. And I think that for us clinicians, when we think about a patient that we, like if you recall a case of somebody who has healed, like someone where you've experienced some kind of a cure or a profound healing, not just a nice improvement, not just a substitution of other medications, but someone who's really changed and no longer has that disease or condition, what we're usually recalling is someone that's made this repatterning or this pivot in their lives related to all of those three factors: the physiology, the thoughts, and the behavior. And so I think that very often people experience those kind of pivots with the help of cannabis. This, I mean, of course, I'm biased because almost all my patients use cannabis. But when I see this happen and I ask them about it, very often it is the psychoactive effects of cannabis that has allowed them to disengage from their pre-existing patterns that they were kind of rigidly locked into. And then in that state of disengagement, I don't know that the repatterning comes from cannabis, but I think it comes from the health. It's just that cannabis kind of opens that door for one's own health to adapt to the current situation. And so I call it a living medicine because it's a relationship with this plant. I mean, you know, and that relationship goes through different phases over time, just like any relationship would. You know, for years it's a party, and then for years it's a relief, and then for years every time I smoke it I get anxious, and then for years, you know, it's something else. I mean, people go through these different phases, and you know, as the clinician, when I feel like my job is to be like a relationship counselor between the patient and cannabis. How can you interpret these messages that cannabis is giving you, and what can we do to really listen to cannabis when it is showing up as a teacher?
Yes, absolutely. Patricia, do you mind if I follow up with a patient example of what Dustin is talking about?
Not at all. Go ahead.
Oh, okay. I had a PCOS patient who consulted me regarding using cannabis for her PCOS. She was very firm that she would only use cannabis to help her manage her condition. Her mind was very close to trying anything else, and her anxiety was palpable. Of course, I counseled her appropriately concerning all the treatment options and the reasons for their use, but I ended up, of course, recommending cannabis to help with sleep and anxiety management to start with. And after using cannabis for about three months, she returned to my office wanting to discuss and she called it those other things she could do. She was in a much more calm and open-minded state. It's like I could see she had opened up compared to how she was in the first visit in which I saw her. It seemed the cannabis use helped to open her mind. She was more receptive about using other things. So I think that's an illustration of what you were referring to.
It's a beautiful example. I like that. I'll share one from this past week that I think is relevant. But even before I do that, I think conversely to your example, Janester, there is a nice qualitative study that came out of Israel a few years back called Return to Normality. And what they were demonstrating is that people, mostly patients with chronic pain, when they used cannabis, they reported feeling more like themselves. They kept saying that cannabis gave me my life back. And that was regardless of whether or not they had symptom improvement, and so I think in one case, it's very, in some cases, it's very nice to let cannabis be this kind of gradual gateway. Oh, look, it's opening my mind because it is working better than these other pharmaceuticals or treatments that I've tried in the past. And what else does it have for me? And what else does plant medicine have? Or what else does integrative medicine have to offer me? That's a beautiful, like, gradual lubrication. And at the same time, like, some patients get no symptom relief, yet cannabis still makes their quality of life better, simply because something different is happening in the way they relate to themselves and the way they relate to their world. And this next case I want to give, I'm going to give you one more little kind of idea that I have, one other framework, but before I provide it, which is this concept of stress manifesting in two different forms: eustress and distress. And so typically eustress is considered the type of challenge, the type of stress that allows us to learn, to get stronger, to get better at something, right? It's just enough challenge that we can gather our supports and use that to grow and to heal. That's eustress versus distress, which is the type of stress that feels overwhelming when we don't really feel like we have the capacity or the resources to respond to it. And then that becomes a distressing aspect of our life and can have a negative impact on our health. And so often the difference between eustress and distress is simply our perception. And when we perceive a stressor as having two sides, like, yeah, there's this kind of bad part about it that's causing me pain, or it's causing me, worry, or whatever it is, but there's this other good side of it that can provide an opportunity for me to grow in a new way, or to change and let go of something. When we see both sides, it tends to be a eustress. But when we only see one side, it tends to be distress. And so think about just globally labeling everything in our lives as one or the other type of these stressors. Well, that perceptual shift, we all have the power to do that, except many of us are too rigid in our thinking and in our perception to actually make that shift voluntarily, even if we said, I really want to change that, but those patterns are still running in the background. Where I think with a little help from cannabis, people get that psychological flexibility where they can start seeing both sides, the opportunity and the challenge. And now the relationship with the world and with the self is drastically different. I suspect, even though it wasn't labeled as such, that's a big part of that return to normality, feeling like myself again. The case I wanted to share is with a teenager, a 16-year-old girl. I spoke with her this week. She's been a patient for about a year. She spent from age 2 to 12 or 13 bouncing around in foster care, significantly traumatic childhood. I won't go into it here, but I'm sure many of you have seen cases like this where it's just hard to believe how many different traumas are there. And then thankfully, her foster mom that she ended up with at age 12 kind of fell in love with her and ended up adopting her. And when I met this young woman about a year ago, she was smoking cannabis and smoking quite a bit of it and doing really better than she had ever done, as far as behaviors, participation in school, capacity to be in public. It was very challenging for her previously. I think her life was just really poor quality of life, and just so many challenges. So when I follow up with her a year later, well, I'll tell you what we did. As you can imagine, similar strategy for those of you that know how I tend to approach clinical cases. Instead of using just inhaled cannabis to kind of chase her symptoms around, I helped transition her to oral cannabis use 2 or 3 times a day to kind of prevent those symptoms, not to the point of getting her that same cannabis psychological shift that the inhaled did, but to kind of mitigate her symptoms and allow her to start participating in life, and also allow her to sleep. And so, fast forward about 9 months after we made that transition, now she is barely using any cannabis tinctures or oils. She uses them just once in a while. She's sleeping without them. She's attending school. She's doing okay without them. Every week she uses cannabis on Saturday evening, inhaled. And I did not tell her to do this, even though I might have at some point, but she figured out by using it on her own. She's by herself. She inhales a bunch of it and has a deep meditation. And she says that's the reset that she needs for the whole week. And when she does that, she doesn't need much cannabis throughout the week at all. And, now that's a change, right?
Yeah.
That's an example of a shift there that, like, the crutch and the tonic are still there for her if she needs them, but what she's really taking advantage of is cannabis as a teacher.
Yeah. Just think of what the world would be if we could get everybody using cannabis. Oh my gosh, it would just be just heaven on earth, where it's supposed to be. I'm sorry, Patricia, go ahead. I'm just getting excited.
No, I was just going to ask Dustin if part of this, with cannabis being such a good anxiolytic, and a lot of times things that are blocked in patients are anxiety driven, and they're in that chronic stress mode, the ability of it to interrupt that stuck circuitry in that HPA axis, and to be able to perhaps lower these chronic stress hormones, to be able to get that limbic system back into an inhibited state where the anxiety goes away, and then that the anti-inflammatory effect as well, that you just have. I tell patients, this is like one-stop shopping, that this is addressing so many underlying contributors to dis-ease, that I just think it's a marvelous medicine. Really
As
do.
always, it seems too good to be true, right?
Yeah.
I mean, list the top 10 challenges from an environmental toxic perspective to humankind right now. And we have all these, for example, neurotoxins in our environment, and then we have cannabis, this incredible neuroprotective substance. We have all these factors that are driving hormone dysregulation and estrogenic activity, and then we have cannabis again, that's this homeostatic modulator of the endocrine system. We have the inflammation and the anti-inflammatory properties, but I think it gets much bigger than physiology. We could think of cannabis not just as an adaptogen for the individual, but I think kind of what you were saying, Janester, is what about cannabis as an adaptogen for the family unit, for the town, for the city, for the state? What about what kind of social adaptogenic properties does cannabis have? And I think, it's kind of obvious if you come to a cannabis, to any kind of event where the community has this shared value of cannabis, there's typically these other shared values there, like generosity and altruism and creativity and innovation and honoring of individuality. Everything that I just mentioned is almost exactly the opposite of this mainstream culture that's kind of being, I would call it a mainstream monoculture that's being, used to, enforce. There has to be some enforcement if everyone is to be the same in different parts of the world and different parts of the country. If everyone is to kind of have the same values, that has to be enforced. And I think in the cannabis communities, there's this polar opposite where we don't want to tell you how to be. We want you to just figure out who the heck you are and be yourself, because we know when you do that, you're going to bring the most value back into this community, and you're going to be the most fun to be around. You know, and that's part of the what else is that healing journey? Like, what has that young lady done? You know, either of our patients, you know, I suspect there's a process of figuring out who she is and becoming that person. Again, now we're back to this kind of return to normality. So the adaptogenic effects at the level of society, possibly at the level of politics or policy making, I think could be profound.
Absolutely. I think it would be great to really start looking at that more in studies, and maybe finding some way to put this in some sort of form in which we can share with other people, and people can understand that there's more to cannabis than meets the eye. Absolutely. And I don't want to necessarily stay on the psychoactivity, but I do. Is there any distinction between the psychoactive effects of cannabis and the effects of psychedelic medicines, or not?
Well, I think these different kind of consciousness altering plants all have maybe their own, you know, flavors or certain properties that might be, you know, more appropriate for certain clinical situations. You know, the three that I have the most experience with are cannabis, psilocybin, and ketamine. And, you know, I think that they can be to some extent used interchangeably. They all have benefits for pain. They all can kind of loosen one's consciousness in the way we described here. But they have some very different effects also. Whereas, you know, for example, cannabis may at some point, after being really nice to a person for a while, start throwing things up in their face like, okay, you're ready to deal with this now, do that. You know, I think that's one property that cannabis has that ketamine really doesn't seem to have, where it allows people to kind of view their trauma from a very safe, fluffy cloud in the sky kind of a thing. You know, and whereas, you know, I think psilocybin is excellent at helping people resolve inner conflict around mortality. Cannabis could help with that, but I don't think it helps that as nearly as powerfully as psilocybin does. And so I think each has their specialty, but when we really get down to it, Janester, I'm going back to what I said earlier, is that these substances open the door. But I believe, and opening the door to me means disengaging from our repetitive patterns that we've been stuck in. So that disengagement, which could happen from a substance, it could happen from a hypnotic induction, it could happen during a traumatic event. I mean, there's, you know, it could happen in meditation or after sex. I mean, there's lots of things that could help us kind of disengage from our patterns. But after that disengagement occurs, the healing or the repatterning, I believe, is a process of the health. And when I say the health, I mean a complex adaptive system from which new patterns emerge directly. And those new patterns are more suited to the current environment, the current interface between internal and external world.
Absolutely. Absolutely. Patricia?
No, I was just going to ask Dustin, in your book, I'm sorry, in the modules, probably in the book as well, but what kinds of things that you talk about endocannabinoid tone and a lot of these exposures, environmental or emotional, that sort of downregulate the endocannabinoid system so that the body is not as well prepared to sustain health or homeostasis. What are some of the things that you feel are most important that can contribute to improving endocannabinoid tone?
Yeah. So, and it's of course not surprising that the answer to that question points to a lot of other health promoting things that probably many of us have been interested in. And then we figure out, oh, that's one of the ways that that thing is working is through the endocannabinoid system. I think, you know, an obvious place to start are physiologic building blocks for the endocannabinoids. And we can look at this shift in our diets from omega-3, omega-6 balance, which maybe our ancestors enjoyed, to this really omega-6 fatty acid heavy diet that's coming from grain and seed oils with very little omega-3, unless we're kind of going out of our way to eat some sardines or to supplement with fish oil. And it's been shown in animal studies that having an omega-6 to 3 imbalance changes the output of our endocannabinoid system. There's a lot of nuances here that we don't have time for in the webinar. So a lot of you probably know that anandamide and 2-AG are produced from arachidonic acid, which is an omega-6 fatty acid. But there's also other endocannabinoid-like molecules of these entourage cannabinoids that are produced from omega-3 fatty acids, and actually having substantial levels of omega-3 will kind of drive the omega-6 endocannabinoid production, because that omega-3 can start to displace omega-6 in the cell membrane and then allow it to be used for production of other compounds, including anandamide and 2-AG. So, a very basic dietary approach, to try to, in some ways, mimic the diet of our ancestors when we involved this kind of big cerebral cortex that has, a need for a lot of these omega-3 fatty acids. That would be, one example of something that we have a lot of data on: omega-3 fatty acids for cardiovascular disease and cognition, for autism, for asthma, for all these things. It's just kind of one of those basics, and it helps the ECS function better. Another one related to diet is just simply avoiding compounds that are disrupting the function of our endocannabinoid system. And so the phthalates that are plastic hardeners, there's several pesticides that have been shown to interfere with endocannabinoid function. I don't think any of us can completely avoid these, but if we kind of look at, for example, environmental working groups, Dirty Dozen, the top 12 pesticide containing foods, and try to shop organic for those, and not eat them when they're covered with pesticides. Maybe just skip them, just fast, and we'll get back to fasting also. But that's let's avoid the toxins that disrupt the system. Let's feed the system with what it needs to work well. And there's many others that we can talk about.
Yeah. And to let everyone know, Dustin goes into that in his module. It's he goes into it beautifully, as usual. And I believe it's also, and yes, it is in his book too. I wanted to ask you about, you mentioned other activities that can be enhanced with cannabis use, including meditation, yoga, mental health therapy even, and one that we sort of touched on, and that's seeking spiritual connection. Cannabis can help patients go deeper. What is your experience with that? Tell us about your experience with that, please.
Well, I'd say that my personal experience with that has been profound and life-changing. When I found cannabis when I was 15 years old, maybe the first couple of times I didn't recognize this, but at that time in my life, I was very hungry for some type of experiential spirituality. In the household I grew up, my mom was very spiritual, but there was no framework for me to actually experience that directly, or very little framework. And my family was Reform Jewish, and I didn't find anything in that kind of infrastructure that satisfied my desire to feel something greater than myself. And very quickly, when I started using cannabis, I realized that this brings me into a place where I am feeling connected. I don't care if I call it God or nature or just something greater than my little limited, contents of my skin. And that was powerful for me, and it continues to be powerful for me. When I usually at least once a week, I wake up early. I go downstairs, I sit down, it's quiet, it's dark. I'll vaporize some THC dominant cannabis, and I will just sit. And it is amazing. I look forward to it every week because that's like the deepest meditation that I have typically of the whole week. And the feelings of insight and connection that I think cannabis helps me achieve, kind of like that 16-year-old, they keep me going for the whole week. And I have such a love. You can tell I love that aspect of the plant. I think for patients to achieve that is very easy. Usually it's just a suggestion that it's possible, and a little practical advice about how to create the setting to facilitate that, meaning you got to turn off your phone and your TV, pick a spot that's not cluttered, maybe go out into nature, like sit down and see what happens. This isn't use cannabis and then do, this mantra 1,000 times. This isn't, use cannabis and then do this breathing exercise. Those things are great too. And we can talk more about some of the modalities that I think are best to combine with cannabis. But and what I'm suggesting now is to explain, like I'll explain to my patients that so many of my patients have experienced a feeling of connectedness to something greater than themselves. And to see if you experience that also, clear a space in your life for an hour, sit down where no one's going to bother you, use a little cannabis, maybe after you're familiar, not appropriate for someone to have a strong psychoactive effect all by themselves when they're not already familiar with this. But, usually people are coming back and saying, oh yeah, I felt a little something. That was like a glass of wine. That was no big deal. And I say, okay, well, we're going to now take that little something and maybe crank it up just 1 or 2 little notches, but do it in a way where you're open to receiving some gift from this teacher, this plant teacher. That's all it takes. Sit down, either have a few drops or a couple puffs and see what happens. And it's amazing. I think so many people on the webinar know what I'm talking about.
Mm-hmm. Yeah, I see a lot of amens. Agreeing with you for sure.
I love what I'm just reading the chat, which I haven't been reading the whole time, but I love what Luna said, that our religion teaches me God is outside and cannabis teaches me God is inside, or maybe that it's both, right? That there's this continuity, this feeling of continuity, and this openness to ambiguity and to paradoxical perspectives, like we were talking about with eustress, right? You see the opportunity, you see the challenge. Cannabis somehow lets us hold these things together. And I think if you look at just neurophysiology of the endocannabinoid system, like when are these CB1 receptors activated? Pretty much when something excessive is going on. Excessive activity in the limbic system, excessive activity in the pain centers. It's much less active in parts of the brain that are already balanced or underactive. But when there's this excess, like the CB1 receptors are saying, okay, like just stop for a second, or just slow down for a second. So that's bringing me back to what I was describing as this disengagement from compensatory patterns and openness to be repatterned.
Yes. Absolutely. Absolutely. There's a question from the audience. I want to take that now. What's your short speech to heavier cannabis users when you have limited time in a visit or conversation to start them on the process to a healthier, more intuitive use? The person asking the question says that, and it's a he, he often refers patients to your reset protocols, but he's more interested in your speech or approach, as you are very effective at articulating things to people, which we are all witnessing today.
Thank you, Janessa. So, general rule is to meet the patient where they're at and synchronize with them. And for me, the process of synchronization requires me to be afferent. So I'm actually listening and feeling the patient, to be present, not to, be somewhere off about what am I going to do next or what happened before, and to be accepting, non-judgmental, just accepting the patient. And so I would, the short speech is preceded with at least a minute of synchronizing. And then what usually emerges is some acknowledgement of where they're at and acceptance of that. And so I brought it up before, but I didn't really go into it. So here's the short speech. Like, I would see someone overusing cannabis and explain to them that sometimes it's great to overuse cannabis and to use a lot of cannabis because, for example, if I break my femur, I need to use a crutch. If I don't use a crutch and I continue to try to walk around on the thing, it will never heal. And so taking the weight off of that is important. And so using a lot of cannabis to somehow get away from or, escape from or put on hold, like some of these things that can be just overwhelming someone in their life, that's good. Like people need that vacation. That's like using a crutch for a broken leg. But if you don't eventually put the crutch down, the leg will never finish healing, because it's the actual forces of gravity through that tissue that stimulate the final knitting together of that tissue. And so, if you see someone walking around with a crutch, you're not going to say, oh, people are supposed to walk on their own two legs, get rid of that crutch. But if you see someone, that has never tried putting it down, especially as a clinician, we're going to say, well, it's been a couple months now and it's time. Your cast is off. Let's bear some weight and start the last stage of healing here. So I use that example to patients and I say, when you're ready, when you've had enough of a break, when you have gathered enough social supports and you have enough internal and external resources, we're going to try putting that crutch down a little bit. And putting it down does not mean discontinuing cannabis completely. It just means drastically shifting the relationship with it. By the way, when you put the crutch down, I'm going to help you spend way less money on cannabis. You're going to feel it actually a lot more. There's all these upsides to basically taking a little tolerance break. So what we're moving into now is the sensitization protocol, which has been on healer.com for, I think, about 6 years. And that's a 48-hour tolerance break, followed by 3 days of self-awareness and very careful titration of cannabis to find one's optimal dose. And it's worked beautifully for a lot of my patients. So that's kind of how I sell it. I hope I answered that question. I think the crutch analogy is a good one. I just in the interest of time, I'll speed through the last part of it, because usually after I provide the crutch analogy, I go into the tonic analogy. I say, well, after you stop using cannabis as a crutch, it's still going to be there for you because it can serve as a tonic, a medicine that helps you stay healthy, that helps improve your resilience to stress, that helps you perform your best. But the way you use cannabis as a tonic is going to look much different than the way you used it as a crutch. And if you're using it as a tonic and something happens, you can switch back into crutch when you need it and then switch back into tonic again. It's good to know both of those. So that's my spiel.
Great. I often advise patients to try not to escalate their dose and to become heavy users by paying attention to how much they're using and the effects they're getting. And when they find that it's not working as well, not to treat it like a pharmaceutical. You don't escalate. You just take a pause, start over with a little less, and build up again until you're getting the effects that you're looking for. And that often helps patients to stay therapeutic and not getting into higher and higher and higher doses, as you said, or it gets to be expensive.
Yes.
And they tend to appreciate the economical benefit of not escalating that dose, but taking a pause. And I've also found that a lot of patients with very severe symptoms that using cannabis, as you said, as a crutch, daily or several times a day, that after a while they find that they don't need it every day, that a lot of what has gone wrong has been fixed. And that's the beauty of the plant, as opposed to a pharmaceutical that we're constantly band-aiding symptoms, but we're never getting up under what's causing the symptom in the first place. And so I always pointed out that, after a while, you may not need it every day. So.
And Patricia, that is so important to point out to patients because they're so quick to use cannabis like they use pharmaceuticals. Mm-hmm. And it's sometimes tough to break that mindset. We develop these beliefs, which are just thoughts we keep thinking, and we need something to disrupt that. And so your counsel is spot on to help that. For sure.
There's a couple of threads I want to pull on there also, Patricia. As a patient coming in to see you being this authority figure that's knowledgeable, part of their critical thinking is already relaxed in your presence and allows it so easily to slide in this one little shift in their perception, right? Because they have maybe only thought about medicine where, in the framework of, oh, it was working, it's not working as well as it used to, I must use more. and then they use more, and that's actually reinforced because right at first it starts working again, but then it stops working and they go back to that same pattern, right? I must
Right.
use more. And you've
Mhm.
just so nonchalantly slid a little thing in there that says, oh,
Right.
by the way, like if it stops working, using less could be the solution.
Right.
And they didn't reject that. They didn't say, no, that's contrary to my worldview, that disagrees with my rigid patterns. I'm not going to listen, because you're you, and you get that in there. I think similarly, cannabis, as it relaxes our critical mind and allows us to start simultaneously perceiving these opposite concepts as being compatible and not just paradoxical, that just like that, oh, it could be the exact opposite, and that might work well too. I thought that was really beautiful.
Yes, very well said, for sure. There's one other question from the audience. Any experience with using cannabis in patients with, okay, it just changed, with alcohol or opioid use disorder? Does cannabis help people to stay sober or clean from their drug of choice? So much in recovery community aren't as accepting of use. And I know I've heard you talk about that before, and we all understand the fact that cannabis is a great therapy for helping people to remain sober and to decrease or discontinue their use of opioids. So take it away, Dustin.
Yeah, sure. So I do have a lot of experience with that. And I think, many of you are probably familiar with kind of the framework of anyone who's having a behavioral issue, especially with a substance or with any type of addiction. But let's just look at the substance. So alcohol or opioids, we don't, at least I don't take the perspective that the alcohol is the problem or the opioids are the problem. I take the perspective that these substances are the solution. Now, what is the problem? Because if we get to the problem and we can find a different way to address that problem, maybe with a substance that's more effective at addressing that problem and has less negative side effects, then we don't really have to deal that much with the alcohol or the opioids. What we're dealing with is the health of the patient. And so, that's the question to ask. Is it old trauma? Is it because you're in some job that you hate and you have to force yourself to go there every day and you're like your own slave driver? Is it, because I mean, there's just so many reasons that are different from one person to the next who might be using alcohol or opioids in the exact same way. Not to mention that it could be pain, that it could be they can't sleep. But there's so many things that people are using those two substances in particular to help with, so many problems that those two can help with, that cannabis can do a better job helping with and provide a number of side benefits instead of negative side effects. So that's where I'll start with the approach to that. And then, I mean, the recovery community, like everything else in the world, has its strengths and weaknesses, and certainly has its trade-offs. I think it's very important for people at some stage to plug into a strong social support group. And that's typically a first step that's essential. Well, maybe not a first step. I think the first step is recognizing I have a problem and asking for help. And then the second step is, wow, there's a lot of other people that are in the same situation as me, and they're willing to help me and to be present with me and to give me a place to belong. That is incredible. Unfortunately, a lot of people stop there and just are in this kind of culture of a self-perpetuating negative self-concept of I am broken, I am an addict. Those patterns in the group setting are probably more comfortable than they are when we're isolated and all alone, but they're still limiting. And, I think a lot of people that are ready to kind of take that next step out of the I'm broken stage of the support group and are recognizing that substances like cannabis and psychedelics are powerful agents for doing that, and no longer needing to identify as broken because there's healing, because healing is possible. I think that's really common, and there's a lot of people in the recovery community that are hiding this instead of sharing it, or that are having to step away from the community because of the judgment on the cannabis in particular. Now, there's green recovery groups that I've seen form. We've had them here in Maine, and I know they're in other states, so patients can look for those. I think that it's what can I say? There's, there's such hypocrisy in our, in so much of our approach to dealing with addiction, substance misuse, we could call it. And I think, the most obvious one is you show up to these support groups that are telling you, not to use any alcohol and certainly never use cannabis, but go help yourself to the sugar, the caffeine, and the tobacco. And, it's like, and I'm not saying sugar, caffeine, and tobacco are bad, but I'm still saying that cannabis is probably better than any of them, and can solve the problems better than any of those. So why would we exclude it?
Yeah, and
Amen.
stepping away from use disorder, what about, there's a question referring to healthcare professionals who particularly who use cannabis for physical ailments and being able to navigate licensure. I suppose these are people who are subject to random drug testing or scheduled drug testing. Do you have any recommendations for those who are at risk of losing their license for using cannabis? And do you have any words of wisdom, suggestion for them?
Yeah, I mean, I think just see it as one of symptoms that, and there's going to be many to come, symptoms of like kind of the death throes of a dysfunctional system that is just grasping to force people to stay within the confines of this, kind of thought pattern, this paradigm of healthcare. And as so many of us are finding that we can exit it, of course, it's going to be like just trying to keep us in. So what I would say is I'm sure it could alleviate a lot of anxiety to do some real planning. Get a license in another state that doesn't have those kind of rules. Maybe try to change the system from the inside. Even though I've gotten a lot less enthusiastic about doing that in my own life lately, I've done that for years, and now I'm more interested in building the alternative system that's going to replace and outdate the one that's dying. But I think, one of my teachers once told me, tell the truth to God and lie to the devil. I think it's okay to lie. I do. I think Martin Luther King, told us that it's our moral obligation to disobey unjust laws. And I don't think it's a good idea to obey them, especially if it's hampering your own growth and health. Find a way to get out of that state, or change the system, or lie to the system. Get creative. And I guess my top recommendation is sit down with some cannabis and see what insights come as far as a solution to that challenge.
All right, we have to make a disclaimer that this is the opinion of the speaker, not necessarily the SCC.
Oh my goodness, absolutely, absolutely. Well, our time is nearing. Are there any other questions in the chat? I haven't. Here's a person is wondering how the SCC course compares to what's in your book, Dustin. Does it cover the same material? If not, how do they differ?
Well, I think that with the SCC course, you get me kind of talking to you about it, which might be a little different in the book. I do my best to inject my kind of own flavor into the book, but it's really written more as a reference. And I think the course is going to be you'll feel a little more like human connection there. I'm trying to remember which one I wrote first. One is probably more updated than the other, but I honestly can't remember what order that came in. But it's, I don't have a great answer for that, but I think you'll find them distinct and both worthwhile.
And very complimentary of each other. Absolutely. Yeah, I've read
sure
them
that
both.
and the book that expands certainly gives a lot more detail on other aspects of cannabis medicine other than health
Sure.
promotion.
Yeah. This is just one. This is just the last chapter in my book. The topic of this module.
Mhm. Yes.
Well, Dustin, thank you so much. This has really been, as always, an amazing discussion. We love talking to you, and you have so many pearls and words of wisdom. So thank you so much for joining us, and a reminder to everyone to please get his module, and there's a lot of really good information in there that can be that most of us can benefit from. All of us can benefit from.
Right.
Thank
Yes,
you.
and
I thank you all. I just want to thank everyone for attending and supporting the SCC, because there's a change, a revolution happening in healthcare, and we are one very important hub of that. Please stay plugged in, and thank you, Patricia and Janester, so much. I love being with you both.
Well, thank you, Dustin. Absolutely. It's wonderful as always. And I will turn it over to Madam Genesis now.
All right. Well, thank you guys again for joining us today. We really appreciate your participation. This has been an excellent segment for Canna Talk featuring Dr. Sulak and his incredible insight on cannabis for health promotion and disease prevention. As a friendly reminder, please join us for our next segment of Canna Talk, which is going to be next month, featuring the world-renowned Dr. Bonnie Goldstein. And also, in light of this month, we do have the course on sale for cannabis for health promotion and disease prevention. The code is Dr. Sulak 15 to get the course for 15% off for non-members. And of course, SCC members automatically receive 20% off. So please be sure to check out the course and purchase it before the sale ends at the end of the month. We also highly encourage you guys, if you have not already, to join the SCC as a valued member. We offer lots of exciting exclusive membership benefits and also discounts that you guys have access to. Other than that, we hope you guys have a great weekend, and thank you again for your continued support of the SCC and the great work that we do. We will see you guys next week, and thanks again to our remarkable Dr. Dustin Sulak as well for highlighting his module today. Thank you guys so much, and we'll see you soon.
Bye. Namaste.
Thank you, everybody.
Someone asked, is the recording going to be available for later use? Dr. Janester?
Yes, it's usually on the website for members. It
Right.
would be available to members.
And
It's available to members. Yeah, all of the videos and recordings are available to members afterwards.
yeah. And I think what you need about a week before this one gets up, you have to do the editing or something like that, or does it go up right away?
It can take some time to get posted.
Right.
Usually.
Yep. Okay.
So everyone is welcome to exit out. Let's see here.
Is old age a disability? Like being 71, is that a disability?
It doesn't have to be.
Well, I didn't mean that. I meant to join. I just looked up the joining thing. I just listened. I had no idea this was about cannabis versus CBD. I'm involved with CBD, and it's very interesting. I think I might like to try some cannabis, even though I don't smoke. But anyway, I live on Social Security.